there, dental students! Today we're diving into the world of bioceramics in dentistry and why they're the future of root canal treatments. So, what are bioceramics? Bioceramics are ceramic-based materials known for their excellent interaction with biological tissues. They're widely used in medicine and dentistry, especially in endodontics. These materials have become the go-to choice for root canal sealing, pulp capping, perforation repairs, apical surgeries, and even regenerative endodontics. Let's talk about the key players in bioceramics: mineral trioxide aggregate, or MTA, calcium silicate-based cements, and bioceramic sealers. First up, MTA. This stuff is a game changer. It's biocompatible, meaning it plays nice with the body's tissues, and it's bioactive, promoting tissue healing and regeneration. MTA can even induce the formation of hydroxyapatite, the natural mineral component of dentin. This helps in sealing the root canal and reinforcing the tooth structure. Next, we've got calcium silicate-based cements. Just like MTA, these cements are biocompatible and bioactive. They offer excellent sealing ability and expand slightly upon setting, minimizing the risk of microleakage. Plus, they're moisture tolerant, which is a huge advantage in endodontic procedures. And let's not forget bioceramic sealers. These sealers are used for obturation in root canal therapy, forming a robust bond with both the dentin and the root-filling material. Their bioactive nature allows them to induce tissue regeneration at the apex of the root, ensuring long-term healing and success. Now, let's discuss some standout properties of bioceramics. First, their biocompatibility ensures minimal irritation. Second, their bioactivity actively promotes tissue healing and regeneration. Third, they have an excellent sealing ability, expanding slightly upon setting to form a tight seal. Fourth, they perform well in the presence of moisture. Fifth, their natural alkaline pH gives them inherent antibacterial properties. And lastly, once set, bioceramics remain dimensionally stable, ensuring a durable and stable seal over time. Bioceramics are incredibly versatile and can be used in a variety of endodontic procedures. For instance, in perforation repair, bioceramics like MTA are ideal due to their superior sealing properties and ability to promote tissue regeneration. In apexification procedures, bioceramics help in forming an apical barrier, allowing the root to develop normally. They're also used in pulp capping and regenerative endodontics to encourage healing and regeneration of dental pulp tissue. And in apical surgery, bioceramics ensure a reliable seal, preventing reinfection and promoting periapical healing. Sure, bioceramics have some challenges like cost, handling properties, and potential staining, but ongoing research is making strides to address these issues. The future of bioceramics and endodontics looks promising, with innovations like nanotechnology, faster setting formulations, and advancements in regenerative endodontics on the horizon. So, there you have it. Bioceramics are truly revolutionizing endodontics, making treatments more effective and predictable. Keep an eye on this exciting field. It's shaping the future of dentistry. Thanks for watching. Don't forget to like, subscribe, and hit that notification bell for more dental insights. See you next time.